pre-diabetes, the signs and symptoms could be quite subtle. They are not that commonly understood. So that's why they are most often overlooked or missed by the patients. And second, if they go to the doctors also, the blood sugar levels are bit elevated, but not exactly normal, but not exactly into the diabetic range also. So that's why even on the part of physicians, the pre-diabetics are usually overlooked. They consider as part of sort of like normal, and that's why properly lifestyle intervention and dietary interventions are not advised to the pre-diabetics even by the physicians as well. So that's why it is important on our part to understand the various signs and symptoms of pre-diabetes so that we can detect pre-diabetes well in advance and follow proper diet and lifestyle modifications so that we prevent the progression of pre-diabetes into diabetes and progression of pre-diabetes into various heart disease and stroke complications. So there are few hidden signs and symptoms of pre-diabetes which if we can actively look into, we can diagnose pre-diabetes. So these hidden signs and symptoms are, especially in Indian context, in subcontinental context, the most prevalent is abdominal obesity or belly fat. If somebody is having an abdominal obesity which is very prevalent in Indian subcontinent, they are highly likely to develop a pre-diabetes. Second, this is known as acanthosis nigricans. Basically, this is a black velvety type of skin appearance, especially on the nape of the neck or axillary fold. So this blackish discoloration, if it is there, as I'm showing on this picture, especially on the nape of the neck or in the axillary fold, the black velvety appearance, which is known as acanthosis nigricans. And presence of this acanthosis nigricans indicates the patient is having insulin resistance or pre-diabetes. So that is something very important sign to look for. So apart from that, there are few important signs like a person is always hungry or he's craving for sweets. If there is an excessive, always persistently craving for sweets, then also it is indicative of the patient might be having a pre-diabetes. Or after taking a meal, if there are excessive fatigue or mid-afternoon there is an energy crash. So if all these symptoms are there, that also is indicative of probably the patient is having a pre-diabetes. We need to look for pre-diabetes in the blood test. In the blood test, we can do few blood investigation, especially lipid profiles, and in lipid profile also we can give us an indication that person is having a pre-diabetes or not. But as far as criteria for pre-diabetes is concerned, what are those criteria? These are basically we need to do a sugar test, especially fasting sugar. If the fasting sugar is coming in between 100 to 126 milligram percent, that falls into the category of pre-diabetes. Less than 100, fasting sugar is absolutely normal, while more than 126 is in diabetic range. If it is falling in between from 100 to 126, it is in the pre-diabetic range.